equals U is a rallying cry for those who live with HIV.
And it brings them into the HIV prevention process.
How can we effectively use U equals U to end the epidemic?
Ending the HIV epidemic means that we're empowering people who are living with HIV all the tools they need to get to an undetectable viral load, and that we're empowering folks who are not living with HIV to live as healthily, sexually, and in every possible way that they can, so that they don't have to get an HIV diagnosis. And if they do, that they have access to all of the same life-changing and life-saving opportunities that folks who are living with HIV have.
The way that we can reach the 400,000 people who have fallen out of care and don't know their HIV status is by education. Going back to the neighborhoods that are most affected, which we know here are our MSM of color populations and our trans populations and heterosexual women of color, providing services where removing those barriers that they have to accessing care.
Viral load does not equal value. We are not defined by our lab tests. So many of us who live with HIV never imagined a time when we could love, we could have sex, we could conceive children without fear. Fear had been present in the most intimate moments of our lives. U equals U sets us free. Providers must tell people living with HIV and people not living with HIV that an undetectable viral load is untransmittable. HIV stigma is a public health emergency, and U equals U is an effective and immediate response.
U equals U es una herramienta poderosa para acabar con la epidemia.
We just have to use it correctly.